Here are 3 USMLE-style questions focused on the epitrochlear lymph nodes, their drainage area, hand, forearm, and their clinical relevance in secondary syphilis. Question 1. A 28-year-old man presents with a generalized maculopapular rash, including the palms and soles. On exam, he has bilateral epitrochlear lymphadenopathy. Which of the following diagnoses is most consistent with these findings? A. Infectious mononucleose. B. Secondary syphilis. C. Rocky Mountain spotted fever. D. HIV acute retroviral syndrome. E. Hand-foot-mouth disease. B. Secondary syphilis. Epitrochlear lymphadenopathy is a classic but rare finding in secondary syphilis, which also presents with a rash on palms and soles and systemic symptoms. Why not the others? A. Mono posterior cervical adenopathy, not epitrochlear. C. RMSF equals rash but no epitrochlear lymphadenopathy. D. HIV-ARS equals generalized nodes but rarely epitrochlear specific. E. HFMD equals vesicular rash, not maculopapular or with epitrochlear nodes. Question 2. A 35-year-old woman presents with painless firm lymphadenopathy localized to the epitrochlear region of the left arm. She reports a recent painless genital ulcer that resolved spontaneously. What is the most appropriate next step in diagnosis? A. Order monospot test. B. Perform a rapid plasma reagent, RPR, test C. Order throat swab and culture. D. Chest x-ray. E. Biopsy of the lymph node. Correct answer B. Perform a rapid plasma reagent, RPR test. The history of a painless ulcer and epitrochlear adenopathy suggests syphilis, likely now progressing to the secondary stage. RPR is a standard screening test. Why not the others? A. Monospot equals EBV, not consistent here. C. Throat swab equals irrelevant. D. Chest x-rays unnecessary at this stage. E. Biopsy not first line for syphilis workup. Question 3. Which of the following best describes the drainage pattern of the epitrochlear lymph nodes? A. Anterior chest wall and breast. B. Lateral foot and posterior leg. C. Medial hand and forearm. D. Scut and lateral face. E. Abdomen and pelvis. Correct answer C. Medial hand and forearm. Epitrochlear lymph nodes, located proximal to the medial epicondyle of the humerus, drain the medial aspect of the forearm and hand. Enlargement may indicate localized infection or systemic disease, e.g. syphilis. Why not the others? A. Axillary nodes. B. Popliteal nodes. D. Preauricular parotid nodes. E. Inguinal or iliac nodes.